What's up, everybody? My name is Clayton. Thank you so much for joining the channel. If you like content like this, go ahead and subscribe. Hit the thumbs up and go ahead and turn that notification bell on so you get videos more like this. Now, as much as this channel can be extremely reassuring for people, I am not a medical provider or a therapist or any way. I'm just sharing my personal experience. Nobody in the comment section or me can override the diagnosis or opinion of a doctor. With that being said, I do think that this channel is made for strictly helping people with mental illness and how they can get past that. If you are watching this channel, you or someone may be dealing with an illness or mental illness. I think that it's very important to share the stories, but not diagnose people or try to diagnose yourself. If you're watching this video, you or someone you know probably had a panic attack, and you're thinking, what's going to happen now? Or what's next? Well, some reassuring news is that the majority of the population go on to report they have panic attacks, but it's only a couple. It's only 2 or 3, and they're from time to time. Now, there is another percentage of the population, I believe almost 3%, that have a panic disorder. A panic disorder is a disease where it's constantly panic attacks from day in and day out. People can experience multiple panic attacks a day. They can experience panic attacks for months, even years. And it's very, very debilitating. As someone that went through having multiple panic attacks a day, it is a terrible feeling. You constantly feel like you're gonna die. You constantly feel all these physical symptoms, and they just feel like you're impending doom. Like it's tunnel vision. You get real sweaty. Your heart starts palpitating. It's a very rough time. But fortunately, there's some reassurance as well, even if you have a panic disorder. When you have a panic disorder, the first thing that you need to do is go see a doctor. Get that reassurance from the doctor that everything is okay physically so you can work on your mental health. This is extremely important, and it's almost as important as trusting the doctor, because when you have a panic disorder, your brain will not want to trust that doctor. When you have a significant amount of anxiety and worry that goes into your health, you're going to go to Dr. Google more than you're going to go to your actual doctor. And Dr. Google is going to tell you you're having a heart attack, you have cancer, your headache is a brain tumor, just a bunch of crazy things. And I think that's the most important advice is to listen to your doctor. And some people are afraid to go to the doctor, but you have to overcome that fear. You have to go to the doctor. That's the most important thing, because it gives you something to fight. When you start having these panic attack feelings, or when you start noticing that your heart's beating a little fast, you start to get short of breath, then you can be like, well, I went to the hospital, I went to the doctor, and they said everything was all right. You have something that fights that anxiety, and you can start being more rational about it. When you start a treatment with your doctor, follow through. For panic disorder, most people will take SSRIs. That's Zoloft, Prozac, Lexapro. And these are used to treat anxiety disorders, along with a lot of other mental health disorders. If you specifically have a panic disorder, the doctor may refer you to someone that does CBT. CBT is cognitive behavioral therapy. And pretty much it rewires the way you process information and how you think about things, and makes you take a good in-depth look of your thoughts. So that's pretty much it. I mean, just trust your doctor, follow your treatment plan, and everybody, if he says you're okay, you're going to be okay. You can count on that. You don't go against the doctor. All right. Anyway, thank you so much for watching the video. My name is Clayton again. Thanks.